In 1987, Eli Lilly came out with a brand new medication, Prozac. It was the first of a class of medications known as SSRIs. And for psychiatry, these medications were a game changer. Today, they are our first choice for treating not only depression, but severe anxiety and obsessive-compulsive disorder, both in adults and children. However, in 2004, the FDA came out with a black box warning for potential for increased suicidal thinking in adolescents and children. As a result, for a period of time, prescriptions of the SSRIs went down, and the death by suicide in this population went up. Now that we've had a lot more experience with the SSRI medications, not to mention many more to choose from, we better understand the risks and benefits of this life-saving treatment option. We prescribe them regularly to our young patients, but we still need to explain their risks and benefits and go over the black box warning in detail. When you are going over this with an anxious family, it can be daunting, even to seasoned practitioners. After all, telling a parent that the medicine we are prescribing for their depressed, anxious child could make their suicidal thoughts worse? It's understandable how they could have a hard time making sense of that. Having had hundreds of these conversations over the years, I'd like to offer some approaches and suggestions that might make it a lot easier. And don't worry, if you're a patient or a family member who wants to know more about SSRIs and the black box warning, well, stick around, because I'm going to keep this discussion straightforward and try to avoid as much medicalese as possible. By the way, if you want more of these discussions and find them helpful, please subscribe to my channel and like this video. It's what keeps me excited about making them, and you can do both by just checking that icon down there in the corner or the subscription button, and of course the thumbs up icon down there as well if you don't mind. Today, we have many more options when it comes to SSRIs, including generic formulations. The most common are sertraline, fluoxetine, citalopram, escitalopram, and paroxetine, often better known by patients by their trade names, which is Zoloft, Prozac, Celexa, Lexapro, and Paxil. But this is not an exhaustive list, and new ones are coming out all the time. They are currently one of the most commonly prescribed medications, and for good reason. They are generally considered quite safe. They are well tolerated, with few rare significant side effects. But informed consent, that is, the risk-benefit discussion we have with patients, is really important. And we need to do a good job of explaining risks, benefits, and alternative treatments. A common concern is that we're going to scare them away from the medication. But I've found that in my practice that if you're well-informed, open to their concerns, and confident of the treatment, most of the time and most patients are fine with these medications. The thing is, there's risk and benefit to lots of things, including things that are good for us. If you think about it, even exercise, such as running, has risks and benefits. Now, the benefits are obvious. Over time, it can strengthen our heart, help our lung capacity, lower blood pressure, and help us lose weight. But it can be hard on the knees, lead to injuries such as twisted ankles or shin splints, and if you push yourself too quickly or too hard, it can potentially lead to serious risks like heart attack. So what we do is we weigh the positives against the risks, and we do what we can to reduce the dangers and maximize the benefits. Well, the same is true with medicine, and I make it clear to the patients and their families that if there weren't a significant benefit, I wouldn't be suggesting this treatment. Now, I know that it feels like we're living in a post-fact world sometimes, but I still like referring to evidence anyways. There was a large, well-conducted study called TADS, Treatment for Adolescents with Depression Study. It demonstrated that when it came to depression in young people, Prozac, fluoxetine, was 61% effective versus placebo, which was roughly 35% effective. And this was just for depression. We now know that it's highly effective for treating anxiety and obsessive-compulsive disorder, both in children and adults. By the way, this is one of the reasons I avoid the term antidepressant for this class of medication, as it can be confusing and it isn't accurate anymore. However, in 2004, the FDA was looking over the numbers and they noticed what they call a signal in the data that suggested that people under 18 might be more prone to suicidal thinking when taking these medications, and they issued a black box warning. And in 2006, the FDA raised that age to 25. Unfortunately, according to a study in 2007, as a result of the black box warning, antidepressant prescription rates for people under that age of 20 decreased by about 18 to 20%. And they also found that the rate of death by suicide increased by 18% in that same group. A more recent scientific review article found that during the years after the black box warning, prescriptions of antidepressants in young people actually may have dropped around 30%, while the increase of overdose attempts went up by about 22%. So while we can't establish for certain that one thing causes the other, well, there's a lot of evidence to suggest that when we stopped treating depression in young people, suicide attempts increased. Now, a majority of my patients fit right into that category of under 25, and I prescribe SSRI medications regularly. But the black box warning has to be discussed. By the way, what is the risk of prescribing SSRI medications to this population? After reviewing lots of subsequent data based on over 4,400 young people on SSRIs, it appears that there is about a 2% increase above placebo in suicidal thinking. So it is real, and I have seen it in my own practice. However, and this is important, none of those 4,400 individuals in treatment died from suicide. This brings up a point that I always emphasize in my discussion. Thoughts of suicide are not the same as death by suicide, and it's thoughts that the black box warning is referring to. As a matter of fact, the biggest risk for suicidal thoughts and acts is by far untreated depression, not the treatments themselves. This is the reason that the psychiatric professionals have concluded that treatment is not only safe, but imperative if we're going to save lives. So that's the evidence of the benefits and the risks. But how do I boil that down into a manageable discussion with patients and their loved ones without taking up the entire session? Well, I do it like this. So as you know, I feel that you are suffering from depression. One of the very effective treatments is therapy itself, but we also know that adding medicine can help significantly, especially in combination with therapy. The most common and safest medication that I use for depression and anxiety are the SSRIs. You've probably heard of Prozac or Zoloft. We've been using these medications since they first came out in the 1980s, so we know a lot about them. Now, the most common side effects that I see is headache and nausea or diarrhea, which usually goes away in less than 5 days. If it doesn't, let me know because we will probably consider changing to a different SSRI. Fun fact, by the way, there are more serotonin-sensitive cells in your gut than there are in your brain, which may explain some of the early side effects. Who knows? Sometimes we get tired on these meds, so taking it at night might be the best choice. But in other people, it can actually interfere with sleep, so we have them switch the medication to the morning. Now, you may have heard about the FDA's black box warning that these medications can make some young people have more suicidal thinking. And this is true, that somewhere between 1 to 4% of people under the age of 25 will tell us that they're having new or increased thoughts of suicide after starting on these medications. However, we are aware of this and we watch for it, and we have not seen any resulting increase in deaths by suicide since we've been prescribing the medications. On the contrary, we know that by far the greatest risk is to those people who are not being treated for their depression. You are 11 times more likely to get benefit from these medications than to suffer the rare side effects of having suicidal thoughts. Now, of course, if you do have a change in these thoughts, especially an increase or ones that seem different, then I expect you to reach out and let me know, let your therapist know, call crisis, or go to the ER. So that's the gist of the black box warning part of the discussion, along with some of the other side effects that are common. But there are other points that should be covered as well, including the potential for sexual side effects, such as reduction in desire or sensation that can occur in up to 1 in 5 people. By the way, this is when the teens all go, "What?" and the parents all go, "Yes." Another thing that's pretty common is a little bit of restlessness, maybe even a little bit of increased anxiety on the initiation of the medication. And if you don't tell them about this, they are very likely to quit at the first sign of either side effect. And these usually go away in a few days as well. Finally, if there's a history of bipolar disorder in the family, I'm going to talk about the possibility for activation or hypomanic manic symptoms, as triggering these symptoms in this population is a known risk of SSRI treatment. I also think that it's important to explain that side effects usually manifest early, whereas benefit takes time with these medications. So, if they're feeling something right away, it's more likely a side effect. I tell them not to expect any results for at least 2 weeks, and more likely 4 to 6 weeks. This is really important so that they don't give up early with these medications. Now, if you're interested in more talks about medication or other psychoactive medications, how they work, when we use them, stay tuned as I will be updating and migrating my series, Psych Medications for the Non-Prescriber, over to this channel soon. As always, please like this video and subscribe by pushing that button down below. And remember, mental health and physical health, they're the same thing. Arrivederci, and I'll see you in the next video.